Mr. Prasad, is there any echoing?
Yeah, Dr. Kiran ma'am, I think you are on two devices, mobile and laptop.
Yes, echo is there.
Yeah, now we are live.
Aarti?
Yes,
Other
ma'am.
than we are live.
Ma'am, can I start?
Yes, please,
Yeah.
please.
Good afternoon and a warm welcome to everyone. We have been doing these weekly webinars, cutting edge webinars for over a year in association with different OBG societies all across India in the hope to spread more information and have a systematic teaching approach. This 12th of November, we are honored to be doing the cutting edge webinar of the Pune Obs Gynae Society in association with Faridabad OBG Society and Azamgarh OBG Society. We're having interesting topics on laparoscopy as well as menopause. And for that, we have eminent speakers, and we are very, very honored to have very senior gynecologists from both the societies as our guests of honor. No good teaching program can be complete without starting, or sorry, can start without a good prayer. And let's take the blessings from the Almighty and start our webinar with a small prayer. Mr. Prasad?
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः.
So, with the blessings from Almighty, let's start our webinar. I would like to invite Dr. Aarti Nimkar Madam, who is the president of POGS, to say a few words.
Yeah, good afternoon, everybody. I am very much excited to welcome Dr. Mala, 2M, Mala and Maninder, in the good panel. Welcome, ma'am, for this webinar. And we are happy that Faridabad and Azamgarh is participating in this webinar. As Aarti said that these very good topics that on the menopause falls and fractures, and second one is the pitfall and these tips and tricks on the endoscopy in the infertility clinic. So, and I welcome all the chairpersons also for this webinar, and ask the, and we say that our from Pune, this Vaishali is contesting for the VP for the next year. So we expect that she will get the maximum votes from all these societies. So spread the word that the Vaishali is the candidate for the VP and give the vote for her. And Aarti, you can take this webinar further.
Thank you so much, ma'am. I would now like to invite Dr. Meenakshi Deshpande Madam, who is General Secretary POGS, to say a few words.
Oh, hello. So good afternoon, everybody. At the outset, let me welcome you all as the Secretary of Pune Gynec Society to this webinar. This webinar was started by Dr. Meenu Agarwal, Madam. And as you know, she has been brought into the Foxy arena with a majority of votes. So we hope similarly would occur with Dr. Vaishali Chavan also. And she is becoming more and more, more academic now. She's giving us very good webinars with each Tuesday. And yes, I welcome you all, Dr. Maninder Ahuja, Dr. Mala Arora, and all from Faridabad, Azamgarh Obstetrics and Gynec Society to this August webinar. So thank you so much, Vaishali and Aarti. Over to you now.
Thank you so much, ma'am. I would like to invite Vaishali Chauhan ma'am to introduce our guests of honor for today.
I would like to first of all thank my parent society and our president, Dr. Aarti Nimkar, our general secretary, Dr. Meenakshi Deshpande, for all these encouraging words. And let me tell you, when we planned this webinar with Faridabad Society, I spoke with President Madam, Dr. Kiran Chandana ma'am, and Madam was so encouraging, and that is how we started planning. And Madam suggested, and of course, any webinar with Faridabad Society, we need blessings of Dr. Mala Arora and Dr. Maninder Ahuja. These are strong pillars not only of Faridabad Society, but the entire Foxy. So they are the greatest pillars of Foxy, and the amount of work they both have done, especially I would like to tell the youngsters, like it's in unparalleled work, in uncomparable work. Especially I remember, Maninder ma'am, when you were vice president Foxy, the dictionary which you did, Foxy members, is something which we are following since years and years. And same with Mala ma'am, Mala ma'am's academic and ma'am's talks, something which we all follow, and we, wait to hear Mala ma'am speaking.
Thank you.
Towards the formal introduction, Prasad, can you show the slide? Yeah. So to introduce Dr. Maninder, ma'am, as we know, is like so enthusiastic, energetic, and an epitome of everlasting energy. And Madam is President Society of Meaningful Life Management, SMLM, and Madam is going to elaborate about it. And she's presently the various designations and affiliations are. She has more than 50 years experience of holistic healthcare for women, director of Ahuja Healthcare and Infertility. I think Ahuja Healthcare, Ahuja sir is also very active and equally like Madam Ahuja sir, whom I know personally. So this couple is doing amazing work, not only at Faridabad, but at national level. Madam is president of Society of Meaningful Life Management, VP Foxy 24 VP SEPFORMS, President Indian Menopause Society 2014-2015, affiliations with many professional bodies, ISAR, ISPAT, Foxy Editor-in-Chief, Journal of Midlife Health 22-24, founder Faridabad chapter of Indian Menopause Society, member of SAFOMS, NARCHI, Haryana chapter of ISAR. Madam has more than 130 publications, more than 230 citations of scientific article. She's truly a thought-provoking leader, and she has many, many awards and recognition. And we are truly, truly blessed, Madam, to have you with us. And we would like to hear from you, receive your blessings and wishes.
Thank you. Dr. Mala,
Yeah.
you have to introduce.
Ma'am, Maninder ma'am.
Should I say a few words first?
Yes, say a
Yeah,
few words.
okay,
then
okay,
I can
okay.
introduce.
Vaishali, thank you very much for those kind words. Don't deserve that much of praise, but anyway, I've been keeping myself active and working, and perhaps trying in that I have helped myself to become an icon of health, so that is the only way you can talk about it. You have to become the leader from the front by demonstrating what can be done rightly. So that is what initiated me into it. And of course, with Mala, there has been long association when she wanted to start with the Folks chapter, and Vaishali at the same time. We went to northmost point of the India.
Yeah.
Leh.
Leh. That was the thing. And after that, we had gone to Kanyakumari also. So Vaishali is like that for me from the beginning to this time. And she has worked very hard in the Foxy. And the Pune Obstetric Gynae Society, of course, has a very soft corner for me because I'm born in Pune, as I always tell you. And at this time, Vaishali, I wish you best for your this journey, future journey. And I know you are the best candidate which is there available from the West anyway. So we all wish you best, and including myself. And at the same time, now I take this opportunity to welcome all the members who have been there from Pune, Obstetric Gynae Society, Dr. Aarti Nimkar, who is the president, Meenakshi Deshpande, who is the general secretary, Meena, past president, whom I have met many times in Pune, because I think in the maximum conferences I have attended is in Pune only. And then Amol, Dr. Amol, clinical secretary. And then from Faridabad, we have our very, very respected Dr. Mala, Dr. Kiran Chandna, our president, Dr. Bhanumathi Sharma, who is a very, very, not only a senior gynecologist, she's a warrior. If I tell you your history, she's a real warrior in life also. And I'm all praises for her. And
Thank you.
then we have our Master of Ceremonies and Dr. Rajni Tiwari. We have from Ajamgarh Society also, and Dr. Aarti, who is the Master of Ceremonies. So my thanks to all of you, and I wish success to all of you in this endeavor. With that words, I think I'll hand over. Thank you.
Thank you so much, ma'am. I would request Meenakshi Deshpande ma'am to introduce our second guest of honor.
We welcome Dr. Mala Arora, madam. She is the chairperson of ICOG of 2017. She was the vice president of FOXI in 2011. She was the founder of Indian RPL Foundation and the vice president of International Society of RPL. She was the editor of Recurrent Pregnancy Laws, edited first to fourth volumes. And she was the chief editor, World Clinics in Obstetrics and Gynecology from volume 1 to 10. She's received a DC Datta Award for the Yearbook Obs Gynae 2018, 19 and 20. She was the chief editor for Evidence-Based Medicine 1 and 2. Of course, in endometriosis and hyperhomocystinemia, the chapter she has edited. Associate editor of the International Journal of Infertility and Fetal Medicine, and the peer reviewer of the British Journal of Obs Gynae, BJOG, plus the Journal of Human Reproductive Sciences. Plus, I know Mara Arora is a very warm person. We had met before in many conferences, madam, and I remember you for your warm hospitality which you have shown whenever we have come to your place.
Oh, thank you, Meenakshi. Thank you, Meenakshi, so much. No, thank you for giving me this honor, Vaishali. And I know Pune and Faridabad have had a long association. We did this joint conference in Leh Ladakh, which Dr. Maninder mentioned. And we have interacted on many forums together. I think the aim of both our societies has been very academic. And I think Pune has also been at the forefront in producing many FOXI leaders, and now, of course, the incoming FOXI president is also from Pune. I have known Vaishali for more than 2 decades, I think, more than 2.5 decades, and I've always found her very dedicated to the work she undertakes. So I'm sure she'll make a wonderful vice president of FOXI, and I wish you all the best, Vaishali. I love the program you have put together. I think that is also very innovative to have topics which interest different people. And I think prevention of fracture is the need of the hour. We as gynecologists have to educate our women on all the factors. You know, we've talked about HRT for a long time, but there's so much more to it, like balancing exercises, like preventing sarcopenia, doing yoga, and improving balance. I think all that needs to come up in our discussions with our women at the time of their menopausal consultation. So well done, Vaishali. I'm always very proud of you, both at the personal front and at your professional front. You have come across as a winner. And with this, I wish you all the best for this program and all the upcoming programs, as well as your future endeavors. And I'm so happy always to come to Pune, as I did this time when I came and met all of you personally, the warm hugs. Pune is a lovely place to come to, and your society is also equally warm. Thank you.
Thank you, madam, for your warm wishes and for your blessings. You truly are a great, great inspiration for all of us. You're the greatest stalwart, a great doyen, and we are inspired by everything about you, ma'am. Not only academics, but everything, every facet of your personality. We look up to you, and we follow you, and we are your fans, and you know that, ma'am. That is something I always convey to you. So,
Thank you.
coming blessings from you and wishes from you means a lot to me. Thank you very much, ma'am.
Thank
And
you.
same for Maninder, ma'am. Your wishes, blessings. Truly, truly, I'm touched. Thank you, ma'am. Thank you.
Thank you.
Thank you so much, ma'am. With this, we'll get on to our first talk for today, for which I would like to invite the chairpersons, Dr. Kiran Chandna, ma'am, and Bhanupati Sharma, madam. Can I please have the introductory CV slide, please? Dr. Kiran Chandna, ma'am, CV? Yes. Thank you so much. So, ma'am is the director of Chandna Medical Center, Faridabad. She is the president of Faridabad OBG Society and vice president of the Faridabad Menopause Society. She is also joint secretary of Haro Obgyn Society. She was the organizing chairperson for MTP Con 2022. Ma'am has done extensive work for MTP. Her special interests are in MTP contraception and adolescent health. She's also published various journals, and she has won the Surakshit Nari Unnat Bharat Award at MTPCon. Ma'am, it's an honor to have you here, and I would request you to introduce Maninder Ahuja ma'am again for her talk.
I'm already introduced.
Aarti,
Good afternoon.
introduce
Good afternoon.
second chairperson also. Yes, good afternoon, Banu ma'am. Good afternoon.
Good afternoon.
Dr. Bhanumati Sharma, madam. She's had 35 plus years of experience. She is the co-owner of Sharma Multispecialty Hospital in Faridabad, which is a 30-bedded facility in Faridabad. She's an active member of Faridabad OBG Society with special interests in obstetric and infertility treatment. She is experienced as a panelist in multiple OBGYN conferences and the editor of FOGS journal. Ma'am, it's a pleasure to have you here, and thank you so much for
Thank
taking out
you.
time for this.
Thank you. Thank you. Thank you.
Dr. Kiran, would you like to
Yes.
say something?
Yes, ma'am.
Okay.
Ma'am is a motivation for all of us. She is very senior member from Faridabad Society. We welcome and we will always seek her guidance in every aspect of life, be it in the academic region or in society level. Both Dr. Bala and Dr. Maninder, they are guide for us, and they are taking our society to very further level in academics and otherwise also. And about Dr. Maninder, everything has already been said that she has been vice president um, of VOXI, president of Indian Menopausal Society, president of SMLM Society, and her interest is in midlife. She is propagation of women health, and she has got very innovative ideas to her credit, and welcome you, ma'am. And she is going to speak about the prevention of fracture. She always in our meeting, she always tells us one or two tips just in our meetings so that we get the practical points. Thank you, madam, for every endeavors you take for us. Thank you very much, and over to you, madam.
Thank you, Dr. Kiran Chandna, for the kind words. I think I'll share my presentation now because we have time just till 5 p.m. Am I audible? And my
Yes, ma'am.
presentation
Yes,
visible?
ma'am.
I'll take it here. I think, yes. Vaishali, again, thank you very much for carving out this very beautiful program. And you know, my passion is about the menopause and menopause health, as Mala said, it's beyond MHT. Actually, it's much, much beyond MHT, and lots of issues are to be covered. But osteoporosis is one of those issues, very why it's special to me, I'll be telling you. But Society of Meaningful Life Management is one platform which I registered before COVID-19. It was in July 2019 that I registered the body, and then COVID came and they said everybody has to go digital. My purpose was to go on digital so that all of you get one platform where you can share your thought processes. And then your thought processes can be in the form of small videos, public awareness, or for healthcare providers, whatever you want to be. And then you can get a link from that website. And the advantage is that the material will be there always in that website. Just visit smlm.in because we'll be starting the new membership drive also soon. So today's talk, osteoporosis, is my passion for years together. Rather, when I entered midlife, my aim was this thing, because what I had seen is, I'll be just sharing with you falls and fracture prevention in osteoporosis and osteopenia. It's not moving here. It will move here. So anyway, so osteoporosis is a silent thief and a killer, but fractures are not silent. They create lots of noise, and that lots of noise is in the form of pain, in the form of debility, in the form of mortality, in the form of financial consequences on the persons, on the families, on the public health sector globally. That expenditure, that heavy burden is there. And osteoporosis is never alone. It's always combined with sarcopenia, fragility. Now, because we are short of time, so I wouldn't be much talking about osteoporosis, just giving you a overview of that. I have to minimize it. Yes. It's a systemic skeletal disease characterized by low bone mass measured by bone mineral density. But it's not only low BMD, there are microarchitectural deterioration. So what that leads on to decreased bone strength. So increased bone fragility and increased susceptibility to the fractures is there. Those fractures can be anywhere. They can be wrist, spine, hip, pelvis, ribs, or humerus also. So it's a major metabolic musculoskeletal disorder. This menopause osteoporosis is mainly because of estrogen deficiency, but because the age-related osteoporosis can be there, so other causes can be there. So other complications in the body can be there. So when the patient comes to us, we always have to examine them holistically. That is the meaning of meaningful life management, that the woman's health is holistic. You cannot pinpoint that I'm just looking after the osteoporosis. I'm just looking after the menopause, hot flushes or sleep disturbance. It's not like. You have to examine always the women holistically and then treat her accordingly there. Now, why I started talking about menopause osteoporosis was one of my neighbors. She had that osteoporotic fracture. She was about 70 plus, I think. And their walls were adjoining ours. She used to cry at night. And I could hear her cries. I can never forget her cries. They still haunt me. She stopped eating because somehow or the other she did not get treatment for her hip fracture, which she had sustained while just a fall in the bathroom. She stopped eating and she ended her life. I can never forget that. That was the point. When I started looking around and saw so many ladies limping around and all that, and I thought nobody is talking about that. Nobody is taking up their issues at all. So we have to take up. Recently, my friend, 65 years old, she was going for a walk, small pothole in the road. She fell down, had a fracture iliac. My neighbor, 59 years old, to pick up her grandson from sports class, trips in the lawn itself, and then had a fracture. My friend, very close friend, went for swimming, just fell down on the slippery rug, had a lumbar spine fracture, 70 years. These are not the stories. These are the true incidences of the fractures occurring, which we are just ignoring. They can be prevented. So that is the main thing. Should they be prevented or not? So we should be looking into the prevention of these fractures because of the enormous number, 200 million women with osteoporosis. And as the age advances, fracture incidence increases, and 2 in 3 women in the age group of 90 would be osteoporotic, and 1 in 3 will suffer from some sort of osteoporotic fracture. One osteoporotic fracture leads on to another osteoporotic fracture many times. So fractures are more common in women than men. So that is why we have to start looking into these fractures, prevention, their etiology, whatever we can prevent. So the impact is there on the mortality. 3 lakh hip fractures, 20% die within 6 months, and approximately 10% have a second fracture, and 60% of those who survive hip fracture don't regain the same level of independence. Look at the spinal fractures, very common. Many of us colleagues, we find them too. So they lead on to not only back pain, kyphosis, but chest compression also can be there, abdominal space reduced, problems of eating and digestion are there, and wrist fracture, cost in billions, impact is working capability is decreased. And look at the numbers. This number is much more than the combined number of breast cancer, strokes, or heart attacks. But still we talk about those diseases and we never talk about osteoporotic fractures. So these are the fragility fractures. Now, why do we call them fragility fractures? Because they are occurring because our bones have become weak. And when we stand from our, fall from our standing height also, we get those fractures. So healthy bones, they don't break. So sometimes the patient will tell, हम लोग गिर गए तो इसलिए fracture हो गया. गिरते तो सब लोग हैं. हम लोग भी young age में, we used to fall down, but we never had the fractures. So what are the clinical risk factors that we should always keep in mind? So I'll quickly go through previous fragility fracture, age-related, then family history of fracture. That is very important. Low BMI. Low BMI have more chances of having a osteoporosis. But fractures are not more than in the overweight people because they can keep the balance. So because of not able to keep the balance, the fractures are more in obese people. Premature menopause, primary, secondary amenorrhea, all of know whichever the causes of low estrogen are going to increase risk of osteoporosis and fracture. Cigarette smoking, excessive alcohol consumption, low dietary calcium intake, very important. Corticosteroid therapy, secondary osteoporosis. But very, very important is when the women are entering into the menopause, already osteopenic because they never attained the peak bone mass density during the adolescent, which was due to be there. So dual DEXA scan is the gold standard. So BMD is compared to the T-score, healthy young adults. And if it's 1 to -1 is the normal, and -1 to -2.5 is the osteopenia, and -2.5 beyond is the osteoporosis. And these are the Indian FREX risk calculation, fracture risk calculation chart, which you can get on the online. We don't treat the low BMD. What we treat is the fracture risk. So if the fracture risk according to these is, if the 10-year probability of hip major fractures is more than 20%, or hip fracture probability is more than 3% according to these, then you have to start with the treatment. And always, whenever you give the treatment, pharmacological, just remember vitamin D levels and calcium should be done. They should be replenished before you start with the first line of treatment. Patient has to be given the lifestyle modification. We'll be just talking about those things. So these have this calculation tool, FREX calculation tool, has height, weight, sex, previous fracture, parent fractured hip, current smoking, all those risk factors which I have enumerated, rheumatoid arthritis, glucocorticoid more than 3 months, secondary osteoporosis, alcohol more than 3 drinks per day, that is units are there prescribed for that, and femoral neck BMD, which is osteopenia is there. So then you calculate. So as I said, as the age goes on increasing, the fracture risk goes on increasing. One previous fracture increases the risk of other fracture, whether it's the vertebral more and non-vertebral and hip fractures also. Previous fracture, they will always increase risk of another fracture will be there. Disability adjusted life years, I'm leaving here, but they are increased because of the osteoporosis. When the total life of a woman is spent in disability, so that are the disability adjusted life years. Now, if the normal women have 6.1, then osteoporosis will decrease it to these disability years will be increasing to 7.8. Drug therapy will reduce, but just to 5.8. So that means drug therapy later on is not going to help you that much. Prevention is something which is going to help you. And if we cannot prevent the low BMD or osteopenia or osteoporosis, then what we have to prevent? Then we have to prevent fractures. Because osteoporosis is not killing you. What is killing you is the fractures. So what we have to prevent then? We have to prevent the falls. So that is why this topic was very, very important to me, because it's not the diagnosis even. You have to start preventing your falls after the age of 60 years. That is you must do. And our balance goes on decreasing. So why? What are the factors which are important now is that as I said, peak bone mass density in the adolescent, maintenance of that peak bone mass, our surroundings, that you don't find the potholes at public places, at the home, you have the, even in bathrooms, you have the sporting rails and everything. Your hearing, your eyes, your reflexes, proprioception in the space, when you are keeping your foot, are you able to recognize what distance you are traveling? Our body strength, our muscular strength, our balance. So all these, they just help in the pharmacotherapy. Pharmacotherapy will just prevent further deterioration, but recovery won't be there. So you have to prevent the falls, to prevent the fractures. So that is very important, because 10% increase in peak bone mass density in the adolescent will delay postmenopausal osteoporosis by 13 years. So that is why we should start targeting our adolescent. So what is peak bone mass? When the peak height velocity starts in the adolescent, at the same time, bone mass also starts increasing. And that is attained till the age of 17 or 18 years. And then that is later on in the male than in the female. Then it is sustained for some time. In the mid-40s later on, it starts decreasing again. Now, the women who had a girl child who did not get the time to exercise, to vitamin D, to good diet and everything, they will attain the suboptimal peak bone mass density. BMD will be less. So these are, they are already entering into menopause with osteopenia or osteoporosis. So that is why we have to attain this peak bone mass density, and this depends upon exercise, vitamin D, calcium, and your skeletal weight gain and skeletal growth, also nutrition. So vitamin D status should always be 32 nanogram per ml, and below 20 nanogram is complete deficiency, and everybody should be supplemented in these. Even in these age group, if they are not getting the sufficient diet and light, sunlight and everything and exercise, they should be supplemented. This is the age group we have to look into. Now, what sort of exercise is very, very important in these? These are our adolescent children who need the exercise, but at that time, what they are doing is fingertips at various computer controls and studying for their NEET examination and all those examinations. So we have to give them at least 1 hour of daily activity in the form of high jumping exercises, because when you are walking, 1.5 times of your body weight is on your skeleton. When jogging, then 2.5 times, and jumping 3.5 times. This intensity has to be 3.5 times to build up your bones, because your bones respond to your skeletal contractions and impact on the bones, and 100 impact. So if our girls from the low socioeconomic status cannot join these group games of badminton, lawn tennis, and everything, they can at least do skipping. Skipping at home 100 times daily is going to give. This is what games we used to play when we were youngsters, jumping from the walls only. 3 days per week at least, and more than 7 months, then they are going to gain that peak bone mass density, which is required. So this is all about the peak bone mass density. When we enter the midlife, then we have to look into the visual impairment, because if you cannot see properly, you will just fall. So that is why you have to prevent that. Impaired cognition, you are not even able to recognize how long your steps are, gait, your neuromuscular disorder, psychotropic drugs. So all these things you have to look into. Along with that, the bright lights should be there in your rooms and your hallways, wherever you are going. Good sporting shoes should be there. Never on a wet surface, never have faith on yourself. I never have faith on my ability to prevent a fracture or prevent a fall. So I always take the support of a wall or a railing or whatever it is. Never change your clothes by standing in the bathrooms. Always sit down. Always have a chair for sitting, changing clothes, and a stool for taking bath. So these are the precautions you have to take. Avoid medications which can make you dizzy, and regular vision examination is all that is required. Now I come to the exercises. Exercises, they have to improve your balance and strength. I think just take 5-10 minutes. And get the right shoes, no medicines that I've talked upon, your foam for no clutter, everything. Use handrails and everything. Orthosis is something when you have a severe osteoporosis and you have to move out and there are chances of falling down. Please wear those orthoses or the belts which you are using so that you cannot use. When taking anti-resorptive drugs or anabolic drugs, whenever possible, please start yourself on those medications. That is also very important. And best, which I like, I'll talk to you later on, is bisphosphonates, because these are the most cost effective. These are the orthoses which you can have so that they support your spine, your thoracic region, and when you fall down, you don't have the fracture. So it's not the aging is inevitable, that will be there. Low bone mass density will be there, sarcopenia will be there, that will be age related, but you have to slow it down. So balancing exercises for prevention of fall and fractures, and proper posture is very important. Otherwise, where we started, we are going to end up there. We should not be ending up there. So inactivity should not be there. You have to decide, though both were my neighbors, same age, died almost at the same time, but see the activity level and the quality of life issue. She used to work in the rural area. She always used to sit, and for urban areas, so had the osteoporosis. Now, what is the basic exercises which have been advised are the 30 minutes per day of 5 minutes of moderate intensity aerobic physical activity that everybody should be doing. When you change the this thing from mild to vigorous intensity, then you decrease the timing also. Then you can decrease it to 75 minutes total of 1 week also. A balance of preventing falls, which I'll be just talking of preventing falls, will be 2 days per week. Resistance strength exercise is something you cannot avoid. Please add to your daily routine. Beyond your yoga exercises, which are stretching exercises and toning exercises only. So add these resistance exercises. Everybody's advised them. Yes, if you are osteopenic or osteoporosis, then you should be, intensity should be low, and the weight which you are carrying should be low. That should not be the same as the adults are carrying. So how to calculate your intensity? All of us are wearing these smartwatches now, so they can tell your heart rate. So just 220 minus age in years is 50, then your targeted heart rate should be 60 to 70% of that. So that is how you can calculate. It should be 60 to 70% for elderly, where I have not calculated here anyway. You minus 50, 170, take 60 to 70% of that. That comes about to 120 or 130. That's Talk test is if you should not be able to talk when you're walking, you should not be able to talk. You should not be able to sing at all. If you are able to talk, that means your intensity is not the what it should be vigorous. So now we come to the posture. This is very, very important, aligning your body. Because if you don't align your buttocks, your shoulders, your back up neck. So your fulcrum won't be right. Your toe should be pointing forward. And fulcrum from the knee should be just above second or third toe of your foot. Otherwise, if the toes are outside, the fulcrum will come inside. Toes are inside, the fulcrum will go outside. So you won't be able to balance. Even while sitting, please see to it that your balance is there. I'm not sitting rightly, but I'm sitting rightly, but my back is, chair is not proper anyway. So that is, I have told you, then once you have achieved this balance, this alignment, then you stand on your toes. Stand on your toes, then take your hands upwards like you're doing with Tadasana. Then challenge yourself, then come on 1 foot. You cannot come on 1 foot immediately. Keep your foot here by the side of ankle, then by the side of the calf, then you take it by the side of the thigh. So that is way, slowly go on challenging yourself. And turning posture, stand on 1 foot, and then you straighten your arms also. So that is how you practice balancing your body. Now, what is the advantage of this? When you're falling, what will happen? You will come on 1 foot. Now, if you are able to balance and keep your balance there for a few seconds, and then you can bring your other foot forward and prevent your fall. So that is why fall prevention, strengthening your hamstrings, your gluteus, your quadriceps, your calf muscle, your back muscles, and your arm muscles, and your eyesight. Everything is important to prevent that fall and go on challenging yourself, because this is not the forum in 15 minutes to teach you how to do these things. But then my website smlm.in has all these exercises. Just click there, go to the public awareness forum, and you will get all these exercises, and you can learn. When walking, your posture, your fulcrum should be in between your 2 feet, and it should not go forward. So that is very important. Balancing. Then for strengthening of these muscles, you can do lunges and squats. For years together, I think I have been teaching these lunges and squats and tandem walk, fit heel to toe. You take your 1 foot forward, keep it in front of the toe of the first feet, then take it forward again like this. This is the tandem walk here. You're taking the heel to toe walk. Heel to toe walk is something which you have to learn to prevent, and then you can give it challenges in the various ways. Now, never lose any opportunity. Now, this is my grandson who has gone to the park, and he is doing it. And when he is doing it, I said, why not me also balance my body? Let me see whether I can balance myself or not. So see, that's what I'm trying to do, balance myself here. So this is how you challenge your body, and you come to know your shortcomings also. Unless we do them, we won't know our shortcomings. So muscles which have to be strengthened are hamstring, quadriceps, calf, toes, and core muscles. And that is how we are going to reduce our risk of falling by making muscles stronger, improve balance. 150 minutes of exercise per week, 30 minutes daily, at least aerobic also you have to do, and strength training. These are the squats, these are the lunges, squats, and static. I said, yeah, this is very important. Yeah, vertebral fractures are very, very important, very frequent. And we don't have to bend our spines. And most of our yoga postures are bending the spines, which we should not be doing. So what you have to do when sitting or standing, you just stand in front of the chair, bend on your knees, take your back backwards, take your hips and your gluteus backwards, and just sit there. This is hinges. So whenever you are doing any activity, you are picking up a weight or putting a weight, just bend at your knees. You don't have to turn your spine. Don't turn your spine. Turn your feet here, then bend your knees here, and then you put in. Spine alignment should be always straight. That should not be bending. Should be straight. This is curved. They should not be there. This is curved. They should not be there. This is straight. They should be there. This straight should be there. This bending should not be there. So very, very important that you don't bend your spine. This is how you have to learn. Keep your spine straight. Bend at your knees. Bend at your knees. Bend at your knees. Keep a sport to tie your shoes even. Don't bend your spine. Never bend your spine. Even while driving, don't bend your spine. Just keep your spine straight. Just bend your head backward. So that is very, very important. So keep this. So movements which increase are the slumping forward. You cannot do crunches for your abdominal muscles. You cannot do toe touching because you are going to bend your spine. So please don't do these exercises. So what movements harm the spine is the bending. This is the golf movement. You cannot because you are turning your spine. That is when you are going to damage your knee. Yes, about dance, it's a very good exercise. It has been scientifically studied also that any physical activity, if you cannot do these exercises, do any physical activity, Tai Chi you can do yoga, but do with the weights, but never bending your spine. So any activity which keeps you busy and uses your energy in a proper way, and if you can add the weights and continued it for more than 6 months, will be helping along with resistance training to build up your bone mass density, keeping your spine. So this dance increases your agility, endurance, mobility, postural alignment, visual activity, happiness, peace, power of limb, expressions, balance, spirituality, hearing. What else do you need? So that's why I'm always talking about. So dancing is the best aerobic exercise which you can do, but do it properly also. Even dancing has to be done in the proper way only. So these are the chart which you guidelines for resistance training, 2 to 3 days, impact exercises, balance training, weight training, and physical activity, which you have to be doing to prevent your falls, because you have to strengthen your hamstrings, quadriceps, calf muscles, your posture, your back muscles, and that you can prevent the falls and learn to stand on one foot as long as possible. Even lunges, you should learn to do on one leg, bend your knees and do the lunges. So too fit to fracture, this was the expert panel, and they have come out with the exercises which I have told you. We should not be doing spine bending and all those exercises, and which you should be doing. Even osteoporotic and osteopenic fracture power training is there. So yes, just 1-2 lines about treatment, pharmacological treatment. Now, instead of giving bisphosphonates, sometimes they start with the anabolic drugs first. So they build up the bone and then they start with the bisphosphonates. Now, there are various drugs available. Denosumab is the anabolic drug. Then tissue selective estrogen complex, bajodoxin C, which is not available. Yes, estrogens are the first line of drug advice for the prevention of osteoporosis. Whenever the patients have symptoms and risk factors, you can give the estrogens. Though so far, guidelines don't write it. They say they can be used for prevention. But when the patient have other indications along with that, you can give estrogens for a long, long time. So this is the last song. This was 1956. Doris said, "Oh, Sarah, Sarah, whatever will be. The future is not ours to see. So what will be, what will be. But now we are living in a changing world with a changing care. Belief that disease, immobility, and pain are inevitable had been debunked. Today we know that choices we make from what we eat, how much and how we move, plays a critical role. So please do these strengthening exercises and don't say what has happened to be happened. So just shake and learn. So these are the things these are the impact exercises actually. They will build up your bone. And they are not high impact. You are not at one time taking your both feet above the ground. So these are the high impact exercises without damaging your knees and ligaments. You can do. So always said, even if you have to dance, you have to do it in a proper way. Thank you very much. Vaishali, I hope I finished in time. Hello, am I audible?
Yes, ma'am. Yes, ma'am. Yes.
I'll stop sharing. Yeah.
Thank you so
Very
much, ma'am.
informative. Very
Yeah.
informative as usual, madam. Very interesting talk. And I think we should have workshop from your side at any time
We need workshops,
regarding this.
actually. So
Yeah.
anyway, you go to the website of SMLM. I had forgotten. There are all these exercises are there in small 2 minutes videos only. So you can watch 1 or 2 videos per day at least. Then you can learn these exercises because you have to do them again and learn them. Because it's not like if I told you that you come and stand on 1 foot and you will be able to stand on 1 foot. Please, when doing it, take always the help of some sideboard or a wall. So please go on doing it till you have changed your body. Fall prevention. Yeah, Bhanu. Bhanu, you are muted. Bhanu, unmute yourself. Bhanu, you are still muted. Bhanu, you muted. Can you unmute it, Vaishali?
Now,
Yeah, now you are unmuted.
thank you, Dr. Maninder. Thank you for such a practical approach to a really difficult to manage problem. Awareness is most important, and that is what you have emphasized. And like pharmacological therapy is difficult, you have side effects, but you have taught us that problems will always be there, but you have to prevent further problems by a practical approach. And the practical approach is improving your balance, improving your alignment, and not falling. If we could inculcate this in our daily habits, and if you could get our patients also to inculcate all this in their daily habits, I think we'll go a long way in preventing fragility fractures. Another thing is during winter, at least we should ask them to sit in the sun, to walk in the sun, so that they can build up their stores of vitamin D. That's another practical approach. And it has been a really enlightening session. And your exercises, you train me, and I do follow those exercises. Thank you so much.
Thank you.
Let's have a workshop in which we are also able to imbibe these exercises, and which can tell our patients also, although patients are not very accepting about these things.
No, they do. Once they
And
have
last
had
of all,
a
Dr.
fracture,
Vaishali,
they have
I'd like you to
experienced that
wish
failure.
all the best in your endeavors.
Yeah.
Thank you.
Thank you, Bhanu, for the kind words, and thank you, Vaishali, for giving me this opportunity and
Bhanu,
please do visit smlm.in because you will find lots of material there. And those of you who want to share their experiences, please come forward in the form of narration of 400 or 500 words, which we can share with each and everybody. Like I shared with you the true cases of fractures. These are the true cases of fractures, which motivated me to go ahead and do the work.
Maninder,
And you're talking to us motivates us also.
Thank you. Thank you.
Sir, ma'am, what a fantastic talk. We wish that you would go on and on and on, because every word you said was so practical and it applied, something which each one of us should be doing to protecting ourselves against falls and all. So you truly are very inspiring, right from the way you showed how at the playground you should, balance yourself with your grandson, and your dancing also is an inspiration. Your all these videos of your dance, your exercise, your weight training, your cycling, I think you have revolutionized Foxy into fitness mode. So thank you, Maninder ma'am. Truly fantastic lecture, and I wish every Foxian should listen to you. Every woman should listen to you. Thank you, ma'am.
Anyway, these children parks, they always have these balancing exercises. And that's why I realized that how important it is to inculcate this balance even in children. Chali, anyway, thank you.
Thank you, ma'am. Thank you.
It is a never-ending lectures. This osteoporosis is never-ending.
Like ma'am said, we should do a workshop and we should attend your workshop.
Yeah, thank you. Let's hope somewhere.
Thank you, Bhanu ma'am, and thank you, Kiran ma'am.
Thank you too.
Thank you.
Thank you.
Wishes, madam. Best wishes. And do
Thank
come to Faridabad sometime.
Vaishali,
We will
again,
invite you.
wish
Yes,
you
I-
best.
Yes, thank you, ma'am. Thank you.
Parag has been to Faridabad many times. Vaishali, even you had come, I think, earlier.
I had come once. Yes.
Yeah,
Again,
you had
for
come,
also
I
that
think.
time. I'll
We
be
will
coming
invite you, madam.
Everybody had come to Faridabad, PK Shah, Dr. H.D. Pai, Rishma Pai, Nandita Palshetkar, even Sian Purandare, we had done cervical cancer workshop with him.
Yes,
So
very
we
vibrant.
had the honor of having everybody here. Thank you.
Thank you. Ma'am. Aarti?
Thank you so much, ma'am. Now we move on to the second talk for today. I would request Meenakshi Deshpande, ma'am, to introduce our chairpersons. Meenakshi, ma'am.
Yeah. Hello, everybody. Am I audible?
Yes, ma'am.
Yes, yes.
After that wonderful and really in detail talk of Dr. Maninder Ahuja madam, which has left us spellbound. Now we go on to the next speaker, who is also going to involve us so much so into her talk. And I invite the chairpersons now, Dr. Rajani Tiwari. Is she there?
Thank you, ma'am. Thank you, ma'am.
She
Yes,
is a
ma'am.
diploma in
Thank you so
minimally
much, ma'am.
invasive surgery, and she is a diploma in ultrasonography also. She is a lifetime member of Federation of course of FOXY, IMA, ISAR, and IAGE. And I welcome you, Dr. Rajani Tiwari, to be a chairperson.
Thank you so much, ma'am. Nice meeting
You can I just introduce the second chairperson also, then so that you can speak a few words after that. I would invite Dr. Chanchal Gupta.
Thank you, ma'am.
She's also here. Yeah. She's from Faridabad. She's professional. She's a secretary of Faridabad Obstetrics and Gynec Society. Of course, a life member of FOXY, an executive member of Haryana Association of Gynec Endoscopists, and also the Indian Society of Colposcopy and Cervical Pathology life member. She's got award silver medal in the 30th annual conference of AOGD 2016 and first prize in the paper presentation in IFS in 2017. Her interests are laparoscopic surgeries, high-risk pregnancy, and preventive gynec oncology. So we welcome you, ma'am, Dr. Chanchal.
Thank you. Thank you, ma'am, for the
Over to
kind
you.
introduction.
Over to you, chairpersons, to introduce our speaker.
I would request Rajni, ma'am, to please introduce our speaker for today.
So today's speaker is Dr. Vaishali Chavan, ma'am. Thank you, ma'am, for making me the chairperson for this session. She is MD, DGO, DNP, DFP, FICOG, Diploma Endoscopy, and she is a clinical director of Cloudline Hospital, Kalyani Nagar, Pune. She is a director at Shanvi Clinic Women's Healthcare, Vice President-elect Pune Obs and Gynae Society, Chairperson Peritneatology Committee FOXY, Honorable General Secretary Pune Obs and Gynae Society, and she is having many publications and award received. That is Punya Bhushan Award, Samaj Bhushan Award, Vaidak, Gaurav Purushkar, Lokpat Award, Inspiring Gynecologist of West India Award by the Economic Times. And ma'am is very talented. At the end, we are honorable, like we are blessed that we are going to have a lecture with you.
Yeah. Thank you, Dr. Rajni, for your kind introduction. And thank you to both Dr. Chanchal and Dr. Rajni for being here to chair the session. Mr. Prasad, can I share my screen, please? Yeah. Is my screen visible? Hello?
Yes, it is visible.
Yes, your screen is visible, ma'am.
Thank you, ma'am.
Visible,
Thank you.
visible, and you are audible also.
Yeah, thank you. Thank you so much. So my talk is something which after madam's fantastic talk. I will just cover quickly a few practical tips and tricks to prevent complications of laparoscopic surgery. So first of all, it's important to remember that whatever complications happen are the fault of the surgeon, and there is no complication in the world which is not preventable. So anytime a complication occurs, just remember that yes, it is our fault. And laparoscopy is such a thing that you need a learning curve, and unless you go through the learning curve, these kind of complications do happen. And my learning curve started in 2010 with Professor Mettler teaching me at Kiel University at Germany. And after undergoing various training, coming to this after many years, I have realized that there are certain tricks and tips that yes, we can prevent complication. First of all, foremost is to take each and every surgery as your first. We remember our PG days, suppose our first cesarean or first tubectomy, and how we went and rehearsed the surgery in our mind again and again. And once you are totally prepared in your mind, and you enter the OT and then you do the surgery, then the complications are less. So any laparoscopic surgery, it's better that you discuss with your team. You go through the entire surgery once in your mind, so that when you're actually operating, you anticipate the complications and you're prepared. And if there are any complications, you're completely prepared, and you and your team are on the same page. Another thing about laparoscopic surgery I would like to say is, as we grow senior, then we buy the best of equipments. But actually the reverse should happen. When you're a junior laparoscopic surgeon, to all other youngsters who are listening, as a junior gynecologist, when you're entering into laparoscopy, it's better to buy good instruments, because the choice of instruments also determine the complication. And the WHO safe surgical checklist is very important. When you go through the checklist, the risk of complications are definitely less. In laparoscopy, each small thing matters, right? From the patient's position, the knee pad, shoulder pads. If you don't put shoulder pads, and if you give steep head load, patient may slip off. So all these small things are important. The height of the operating table, the monitor. When you set up the monitor, it should be just below the surgeon's eyes. Many a time in corporate hospitals, the tables are such, like male surgeons are operating, and many a time women gynecologists find that the monitor is way high and the operating table is low. And that triangulation and the ergonomics, if you don't improve it, then there's going to be shoulder pain. So it's important to see that all this ergonomics and triangulation between ports is correctly aligned. Patient selection is so important. Patient selection, thromboprophylaxis, preoperative antibiotics. And in laparoscopy, the tactile, relative lack of depth perception is there. The tactile perception is not there. So here comes the role of tissue identification. When you do laparoscopically surgery repeatedly, you can make out that, yes, this is a tissue, these are the vessel, this is bladder, this is ball. You can identify the tissue, and the knowledge of anatomy is so very important, especially in laparoscopy for tissue identification. And at any given point, how to prevent complication is, at any point you feel you need a second opinion, you feel you need help, you have to call for help. There is no ego, something which you should keep aside and call for help. Now, talking about these complications, according to the different steps of surgery, there are different complications, right from the insertion of the first stroke, the intraoperative, early post-op, late post-op, and so on. Various complications, not only for minor surgery, but major surgery. And then, of course, the anesthesia complications and so on. Anesthetic complication could be if there's a huge patient, difficulty in intubation, or there could be cardiac events. Hence, patient selection is very, very important. The injuries that I'm going to talk about, which we come across very frequently, are the entry injuries or injury to the organs like bladder, ball, ureters, are some of the organs that as gynecologists, we end up, because of the close proximity to the uterus, there's a risk of injury to them, and that leads to complications. So the entry techniques, in fact, all these complication videos which I have, I would like to just say that they're not all my videos. They are videos which I have compiled from my friends and some from the net. So entry techniques are responsible for as high as 60% complications in laparoscopy. And every laparoscopic surgeon should be well versed in different entry techniques, whether Verey's needle or open Hassan's method or optical trocars or direct entry method. So surgeons should know various entry techniques. If this fails, if they cannot generate with the Verey's needle, then at least the next method the surgeon should know. Now, this is a Verey's needle. This is a complication which I would like to show you. And this is a complication by Verey's needle. As you can see, the Verey's needle has been inserted and it has gone through and through the ball, and this has called ball injury. So injury by Verey's needle is a very, very common thing. So what are the simple tips and tricks so that we don't encounter this kind of complications? So there is a checklist of steps. Check for the spring mechanism of the Verey's needle. See that patient is flat. Sometimes very early premature head low can also give rise to ball injuries of this kind. Adequate skin incision needs to be taken, and the angle in which you are inserting depends upon whether the patient is thin built or patient is obese. Also, safety checks like aspiration test, hanging drop test, hissing sound test, and the manometer test are very essential. And if you feel that you have entered into the ball, you should never wiggle the Verey's side to side, because that is going to rip open and cause a bigger injury. Modification of the insertion points. Suppose there's a previously scarred abdomen. Nowadays, with increased incidence of cesarean section, every patient that nowadays we see, every TLH, every myomectomy, every endometriotic cyst, many of them, they come with previous cesarean or previous scar. So what is this modification of insertion point? Palmer's point. Palmer's point is such a point that adhesions are extremely rare, however scarred the abdomen is. At Palmer's point, the risk of ball adhesions is very, very less. And of course, if you're going to use Palmer's point, then you should also put a Ryle's tube to deflate the stomach. Putting the primary trocar. Now, after you have created the pneumoperitoneum, putting introduction of the primary trocar. This is also very interesting video in which you can see that the primary trocar has gone in directly through the bowel. Now, if your primary trocar has gone in through the bowel, it's very difficult to identify that this kind of injury unless you have put a camera through your other 5 mm port. Now, this kind of injury, how do you know you have gone through the primary trocar? Your primary trocar has gone through the bowel. Simple tip is to rotate the primary trocar in all angles, 180, 360 degrees. And if you face an obstruction, you know that yes, you have injured some organ, because only the anterior falciparum ligament is the only structure that is adherent to the anterior abdominal wall. There should be nothing else obstructing when you move the primary trocar 360 degree. So trocar injury, there have been multiple RCTs and reports and studies, and they have said that entry-related injuries remain the highest of complications due to laparoscopic surgery. So what is this safe entry? Now, this is the Hassan's technique, and this is a technique which I commonly use and which is also known as the open technique. So in Hassan's technique, you open directly, take an incision, go through the various layers, and under vision, you open the peritoneum and put in the trocar. So this, there are a lot of studies which have shown that Hassan's technique is superior to the other techniques. And why is that? Because this open Hassan's technique is a preferred mode of entry for complicated or high-risk cases. So when you are expecting a high-risk case, then you are extra careful, and that is the reason the Hassan's technique has lesser incidence of complications. So this is a technique where you take an incision and visualization of every layer, and then you enter the peritoneum. Another technique that is recommended is entry under vision. So this is an optical trocar, And with this optical trocar, under vision, you are entering into the peritoneal cavity. And you can see the various layers of the abdominal wall. So does this mean that the risk of complication is less? No, the complication rate remains the same, but you can pick up the complication. So detection of complication is very high when you have inserted your primary trocar under vision. So this is under direct vision, and this is the recommended by all guidelines. This is the recommended way to enter the. So anticipating mishaps, learning from your error is what is going to prevent complication. And evidence for visual entry, they have shown that the complication is not less, but the incidence of picking up the complication is more. Now, this is again an interesting video of overshooting a trocar. This is the secondary trocar which has been inserted. And when you put in a secondary trocar, you have to put it, with support and gradually. If you put with too much force, then as has happened in this particular case, it was put with too much force and it went and hit and injured this particular vessel. So this is typical overshooting of trocar, which should be prevented as you insert the secondary trocar. So there could be complications, various techniques, open laparoscopy, direct entry, or visual entry are some of the tips in which you can reduce the rate of complication. And there are several strategies. And what are these strategies? First of all, I mentioned the Palmer's point and the optical trocar. With these, you can reduce the risk of entry. Primary trocar complication. Now coming to secondary trocar. Secondary trocar, the commonest injury that happens is to the inferior epigastric vessels. So how do we prevent that? The simple thing is to identify where the inferior epigastric vessels are. And for that, this is the round ligament. You trace the round ligament and you reach the inguinal ring. And just above that and medially is the inferior epigastric vessel. So it is important to know where it is located. And once you know the anatomy and where the inferior epigastric vessel is located, it's difficult to injure it. Like in this case, inferior epigastric artery is injured. And once it starts bleeding, many of you who have encountered it must have seen that it bleeds a lot. And if such kind of bleeding happens, you have to achieve hemostasis there and then. And either you can achieve hemostasis by coagulation, and sometimes you may need to put in a suture and stop the bleeding. So many a times, if it's a big vessel which is bleeding, simple coagulation does not help. So knowing the anatomy as to where the inferior epigastric artery is located can help prevent this kind of bleeding from the inferior epigastric artery. And if coagulation does not take care of it, then you need to put in a suture like Mochi suture or cobbler's needle, what we call. And that takes care of this kind of bleeding, as is done in this particular list, in this particular case. Yeah, so suturing stopped finally bleeding for this patient. So complication apart from this are the injuries to the internal organs, and sometimes there could be subacute emphysema or gas embolism also. Now bladder, they say bladder is the biggest predator for bladder injury is the gynecologist because it is located so proximally. So in this case, you can see that vaginal vault is being cut and inadvertently the bladder is being opened. Now, there's so many things which have gone wrong in this case. And as you can see, there is bladder injury and bladder is visible. Yes, so this is the bladder injury. Now, what are the things that you can do to prevent bladder injury? So there are many, many tips and tricks which can prevent an injury of this kind. And first of all, it's important to remember that bladder is a forgiving organ. If there is a bladder injury, you can repair it there and then in by 2-0 or 3-0 Vicryl in 2 layers or 3 layers. And it heals beautifully And bladder truly is a forgiving organ, and you can suture it there itself. So what are the tips and tricks? How do we prevent bladder injury? Now with the rising cases of previous cesarean, we see more and more cases of in laparoscopic hysterectomy. They come with previous one cesarean or previous two cesarean.
Hello.
So common, yeah, here. So the common tips that I would like to give you.
I think.
Pardon?
Okay, I thought we missed call. Okay, it's okay.
Yeah, can I continue? So this is creating, if there's a scar tissue previous cesarean, then it's better to go from lateral side to central side, create starting from lateral. And sometimes what also helps is picking up the bladder tissue and then dissecting the utrovesical fold. So how do you detect that, yes, there has been bladder injury? Sometimes there's hematuria, sometimes there's air in the air in the urosac, and the assistant may tell you that there's a lot of air in the urosac, or there could be urine in the abdominal cavity. So these things make you alert that, yes, this could be on-table bladder injury. And to prevent that, it's important that you catheterize the bladder. And after that, when you, it's always better to do bladder trauma is seen in very high cases, in TLH cases, almost 1 to 2.3% cases. And simple thing like differentiating the margin of bladder, clear understanding of the anatomy, approaching the dissection laterally. If there's an adherent part, then you should approach from, take the lateral approach. And when you're cutting the vaginal vault, see that you have dissected the bladder adequately, at least 3 centimeter beyond the place where you have cut. What about ureteric injuries? The ureter is prone for injury, so it's important to know the anatomy, especially if you're doing a large endometriotic cyst or a large myoma, or cases where there's a lot of pelvic adhesion. So understanding the location of ureter and then dissection is very important. So some tips are, when you're doing a TLH, it's better to dissect the posterior peritoneum. When you bilaterally dissect the posterior peritoneum, the ureter automatically falls on the side and the risk of injury to the ureter is less. Also, once you take the uterine, then it's better to stay medial, as is taught to us in abdominal hysterectomy. The same principle works even for laparoscopy, that once you take the uterine, then you should stay medial to the uterine to prevent injury to the ureter. And ureter must be localized at all given times. It should be identified. And there are a lot of catheters also which have come, yeah. But there's a controversy whether you should, for like in endometriosis or where you're expecting adhesion, should you do prophylactic ureteric catheterization? So the answer is you should not do, because it makes the ureter rigid. But there are ureteric catheters which have come, which have light in it, illuminated catheter. For difficult cases where you're expecting ureteric injuries, yes, you may use these things. Now coming to bowel injuries, bowel is also something which comes in a vicinity of surgery. And if there's this kind of, especially if there's DIE, deep infiltrating endometriosis, then this is a rectal nodule injury. If such a thing happens, it's better to identify injury there and then and repair it there and then. In creating a complication is not a crime, but creating a complication and not managing it can be considered negligence. It's better that when you diagnose the complication right on table and manage the patient there and then, the morbidity for the patient is definitely reduced. When there's a rectal nodule injury like this, it's better to involve the general surgeon. Now, talking about bowel injuries, this is another interesting video of bilateral endometriotic cyst. And while dissection, the bowel got injured. And any complication like this detected on table is actually a very good complication to have, like you have already detected on table. So you involve a general surgeon who will suture you. And for medical legal purposes, it's important You may be able to suture this bowel on your own, but it's important to have a general surgeon for medical legal purpose who will repair the bowel surgeon bowel. What about thermal injuries? We use so many energy sources, and risk of thermal injury does happen. Like in this particular case, the myoma is the fibroid, and to reduce the size of the fibroid, the monopolar is being used, and you can see that the monopolar, there is the injury to the bowel, which is lying low and whitening. But in this case, it was detected on table, and it was managed right there itself. So wherever there's a bowel injury, whether direct trauma or thermal trauma, it's better to manage there and then with the help of the respective expert in the field. So prevention of gastrointestinal complication, bowel preparation also plays a role. Also putting in a RT tube, nasogastric tube. Sometimes you put a primary trocar and it goes through and through to the stomach. Such cases have also happened. Uncontrolled bleeding is also something which we see very commonly. And in uncontrolled bleeding, once it bleeds, it just the entire field is covered with blood, and then just cauterizing without visualizing is very, very dangerous. So it's important to do suction, remove the blood out of the field of the surgery, identify where the bleeding is, and then either you coagulate or you put a clip. So cleaning the field of vision and then tackling the bleeding, creating hemostasis is very important in uncontrolled. This is again another case of TLH where there was bleeding from the uterine, and bleeding from the uterine, which was identified. See, it is completely occluding the field. So clearing with suction and then putting a clip at the uterine will stop the bleeding. So treatment of vascular injuries is to identify and the surrounding vulnerable organs and to stop the bleeding and then control it either with bipolar or by clips or endoloop and so on. So talking about other complications, there could be pulmonary embolism, deep vein thrombosis. It's better to take prophylactic measures, stockings, pumps, prophylactic heparin to avoid this. So in conclusion, I would like to say that complication can occur in any surgery, and most of the complication, no surgeon goes out, they are accidental, they happen with us, but it's important to take help, to detect it on table, to manage it at the earliest, because unmanaged complication can be considered negligence. So I would like to emphasize again the need to understand the anatomy, the suturing techniques, the principle of energy. And with this clarity in the mind, we can prevent complications in laparoscopy. So thank you very much for patient hearing.
Thank you so much, ma'am. I would request Chanchal ma'am to say a few words.
Yeah. Thank you, Dr. Vishali. It was really a wonderful talk, and you had covered all the steps of complications at each step from entry till the exit, till the including the bowel and the bladder ureteric injuries. So surgical field is like this. First of all, I liked your first slide, which said all complications are preventable. So definitely not all, but at least most of the complications are preventable with the knowledge of anatomy, with the knowledge of your own surgery, and definitely having a like what I do usually is if you are going to operate a different case that day, rehearsing with your team, just revising the steps and going through, everything is available on the YouTube also these days. So you can just have the videos, you can go through those videos before performing that surgery. So definitely that helps in preventing the complications if you are revising your steps for a surgery. Then what I would also advise for the beginners is we should know our limits for the surgery. Laparoscopy is a long learning curve, and we should set our limits till what we can do. And in every step, in every new case, we should always break our limits in the next case. That is very important. So that's the way of learning a laparoscopy. Then complications definitely can happen, but detecting the complications on table and correcting the complications, we will be medico-legally safe. So even in medico-legal aspects, if we consider any complication can happen in any surgery, but not detecting that complication and not correcting that complication, then we can be in a suit.
Rightly said, Dr. Chanchal, and your expert feedback about the talk was really very valuable. Every point you made is truly very practical, especially if there's a complicated surgery, going through a YouTube video to just, analyze the steps so that you can use them. Very, very practical tip. Yeah, thank you so much. Thank you. Dr. Rajni is there? Maninder ma'am, Kiran ma'am, Banu ma'am, would you like to say anything?
Yeah, Vaishali, congratulations. I think you came out with a very nice topic because that is of importance to everybody, the complications. Complications of any procedure when I think we are learning a new procedure. We have to learn, as Chanchal Gupta said, of course, the right step and revise them with your staff. That is very important. And assistant also when you are doing a new case. And yeah, about social media to make, because I think social media is something where we have to utilize the resources which are available on the social media, but we have to be very responsible in posting also in social media. I think associations now are taking that subject because that is the topic of our panel in presidential conference. Jaideep talks, that is the good, bad and ugly about the social media in professional, in obstetrics and gynecology. So laparoscopic, endoscopy and imaging sciences, practical, whatever we are teaching, even the obstetrics and everything, they have lots of evidence-based medicine now. That is what it should be, evidence-based medicine. And when we implement, I think we should see the impact of any new thing which we have come out. So webinars are helping us a lot, even when they are going to a small number through different institutions. At least they are approaching a new batch of new minds also. So Vaishali, congratulations for making this possible. And thanks to Faridabad team, especially a vibrant team, I must admit, and Kiran Chadna, Bhanu, Chanchal Gupta, they are all doing so wonderful work. So my thanks to you again and congratulations and wish you best. I think Vaishali, you should do well. Just
Thank you, ma'am.
yeah.
I think Dr. Rajni is there. She's representing Azamgarh Society. Dr. Rajni, are you there? Yeah. So, Aarti, should we go ahead?
Yes,
Maninder
ma'am.
ma'am,
Thank you so much, ma'am.
again and again for your wishes and blessings. Thank you to entire Faridabad Society again and again.
Thank you, Dr. Vishali,
Yes.
and all the best.
Thank you so much. Thank you.
Thank you, ma'am. Meenakshi ma'am, we would request you to give the vote of thanks.
Let's say cheese.
Let's say cheese and kudos for a very well organized seminar and webinar today. Very nice, and I really would like to thank from the bottom of my heart all the faculties, the chairpersons, and everybody who has joined today, even the delegates. And we have got a large number of delegates. I was just inquiring, we have got a very good number. And kudos to all of us and all of you team over there. Also thanks to the BSV team, RX Events, for giving us a good platform. And of course, Dr. Aarti for doing the MOC in charge of today's program. Thank you so much.
Thank you.
Okay.
Thank you.
Bye.
Bye.
Special thank you, Aarti, and to all of you. Thank you.
ma'am. Thank you, ma'am.
Thank you. Mr. Prasad?
Ma'am, he has left. He had to leave. He had a meeting. He called me and he left. Ma'am, you're muted.
Aarti, you conducted very well. Congratulations.
Thank you, ma'am.
Kiran ma'am, I'll be coming to Faridabad in 1 or 2 months. आपको मैं आके मिलूंगी. We'll do some CME. Ma'am, you're on mute.
Definitely. Definitely.
Yes, ma'am. I'll come get in touch with you, and we are thinking of organizing a CME there. आपके साथ.
बिल्कुल बिल्कुल.
Yeah.
Okay, madam. Bye bye.
Thank you. Bye. Bye.